my name's Amanda Azzopardi from Amanda Azzopardi Aesthetics, and I just want to have a little chat to you today about the importance of a full medical consultation prior to treatment. I'm just going to wait a couple of seconds because the internet takes a while. So the chat's about a medical consultation prior to treatment and why it's so important that we undertake this journey together so that we get to know each other a bit more. So for me as a practitioner, I would never undertake an actual treatment without having a lengthy discussion with a client or a patient first. And it's no different, I feel, to me working in a hospital and undergoing a consultation or a chat or finding out about somebody's medical history in my job in the hospital. Okay, so you're undergoing a treatment. It's not a surgical treatment, it's a non-surgical treatment, but there are still risks, and you need to be aware of all of these risks. There'll be outcomes, there'll be good outcomes, there'll be outcomes that cause a different concern, and it's my job to get to the bottom of where you want to go with your treatments prior to having that initial treatment with you. So when you first contact me, it might be through a variety of different sources. So it might be through Instagram, through Facebook, it might be via text message or through my website. There's lots of different points of contact. You might pick up the phone and call me, and that's all fine. But when you're having a text message with somebody, it's very difficult to see what their skin's like, what age they are. I need to know a lot about you before I can start any treatment on you. Another thing that's very important is to know what your goals are and your expectations from that treatment and whether that treatment's the right one for you. So there's a lot of different reasons why people come to me for treatment, and sometimes it's their skin. They might have large pores or acne that they might not like, or they might be aging and have some volume loss or some fine lines and wrinkles that are appearing, or they might just have a concern that they don't really know what I do, what service I provide, and they might want to have a chat about where they can go with their problems, like their fine lines that are coming or their jowls that are forming. So there's a lot of different reasons why people come to me, and I need to know sort of a bit of background about you before I can treat you. So sometimes you're coming to me because you've seen a photo of yourself on the side that somebody's taken at a barbecue, or you've noticed that you are getting some jowls with age, or your skin quality is very dull, and you'd like to improve all these things. It's important to me to know the reason why you've come to me in the first place. So there's lots of things that can happen in your skin from the ages of 20 to 30, then 30 to 40, and what we see on the outside, just the superficial layer of skin, it's a lot more intricate and involved when we go deeper down. So you've got your layers of skin, and then you've got your fat pads, and you've got muscles, and you've got bones and ligaments and vessels to take into consideration. So when you're telling me about the concern that you have, and I'm thinking about the treatments that I can offer you, there's a lot of different levels and layers of your face that I have to consider. It's really nice to sit in front of you and see your face move and see which way your muscles move, and sometimes you send me a photo first, and that's okay, but it's really nice to have that conversation with you, that consultation, so we can, even developing a bit of rapport, a bit of trust between the two of us is nice, and it leads a long way into developing a positive practitioner-patient relationship that can form further on down the line. It's nice to have trust in your practitioner, and trust in yourself that I can provide you with the treatment and meet your expectations. When we meet, there's lots of different stages of people's lives that they come to me at. It might be a reproductive stage, or a perimenopausal stage, or a menopausal stage, or you may be way through that. But there's different things that occur to your skin, and different things that occur to your fat pads and your muscles through all of these stages of your life. So you may come to me with just wanting to have a scar rejuvenated or refreshed or smoothed over, and that's very important to some people and their outward appearance in how they look, and that really affects their internal feelings about themselves. So there's a lot of things I can help you with, and it's much nicer to have that consultation, that journey together. It's a major step in allowing me to provide you with a safe and successful approach to your treatment, to achieve your goals both emotionally and physically. And it doesn't matter what stage of your life you're at. If you come to me seeking help, whether it's been triggered by an emotion or by a physical appearance, we can achieve these results. And it's also my responsibility that if I can't provide you with a service, or I feel like the treatment that you're seeking is outside of my scope of practice or outside of my the treatments that I can provide, then it's up to me to say so, and sort of I can refer you on to somebody who does provide that service. So it's not just all about me providing you with a service. I want to be able to meet your needs, and if we can have this chat together, then it facilitates the opportunity for us both to be on the same wavelength and know exactly what your needs are, and where you want to go with your treatments in the future. Now, getting down to the nitty-gritty of it, legally and professionally, I need to know about things like all your medical history, the medications that you're currently taking. Sometimes when you're taking a certain medication or you have a particular medical condition, it does render you not suitable for some treatments, but other times there's treatments that will be much better for you. So if I have that knowledge in place, I can offer you the best treatment possible, and I can also get the best outcome for you. So if sometimes you might have diabetes or a thyroid problem, and certain treatments are not completely contraindicated, but they may be a little bit more complicated and need to be approached with a bit more caution. So if I know that you're on certain medications and those medications react to a certain product that I'm using, then we can avoid those products. But if I don't have that knowledge on board to begin with, it provides you with a suboptimal service. You're not going to get the very best out of your treatment that you can. And like, if I want to, often I need to know your surgical history as well as your medical history, and any scars in your face that you've had that may have caused underlying concerns that we might broach during treatment. Knowing about these beforehand can optimize your treatment as well. You may have been through an emotional journey and had a lot of weight loss, or just had a lot of weight gain, things that happen with life, or all this changes the shape in your face, and it changes the way the skin on your neck. So all these things can affect you. You may come to me for certain treatments that if weight gain or weight loss has been a problem, this may affect your treatment that I can offer you. There's also things that certain environmental factors like smoking can affect your skin quality. So we can talk about rejuvenating your skin quality, or reducing your smoking, or alcohol intake can really dehydrate your skin. But the main thing is, if we have a really good background of your medical history and your surgical history and the medications that you're taking, and we both know where you're headed with your treatment journey, then we can make it a positive experience for both of us, and we can get to where you want to be. So I am very excited, and I do love a medical consultation because it opens up a lot of doors for both of us, and we find out a bit about you and the options that are available. So I know it's very difficult at the moment. I do prefer to have face-to-face consultations. However, I am doing video consultations and FaceTime consultations. So if you want to have a chat with me or you'd like to come and see me, you know, there is going to be a time when we're functioning again very soon in the future. So give me a message or send me an email. It's amandaazzopardi.co.uk, or if you go onto Facebook, my phone number will be there, and we can have a chat and organise that first meeting and break the ice together, so we can see where you want to go. All right, have a great weekend. Happy Valentine's Day, everybody, and I hope to see you soon. Give me a call and we can have a chat. Bye.